As part of the National Health Insurance Plan, the Health Department is reorganizing the healthcare system to reach people before they are sick. One of the ways it is doing this is by setting up schools outreach teams to visit schools and screen children for health problems and make sure they have had all their vaccinations. One of the NHI pilot districts is the Amajuba district in KwaZulu-Natal, which has been setting up these schools outreach teams. Teams of professional nurses visit schools in the area and offer essential healthcare screenings and education to students.
These school health teams are looking at preventive, promotive, as well as corrective therapeutic needs for children at schools. So what this means is that those children who have not received any level of care during their preschool years, the school health teams are there to actually ensure provision of those health services.
Sister Nandinyati is able to screen 250 children in this district every month.
Lethukuthula Primary School sizokwenza basic assessment. So basic assessment generally is just a physical assessment of our learners from head to toe. Bese ezinye sibhalela ama referral letters okuzisa ema clinic noma lapho kusuke khona umfundi ezothola usizo khona.
By being able to refer cases directly to clinics, they can ensure children get treatment early and prevent complications.
Integrated School Health Program. Kwafuneka ukuthi siqale ngokuthi silinke izikole nama clinics because they are now based kuma clinics. Kunzothi mangabe bane problem engane ayithathe refer to the nearest clinic.
Teachers and nurses are now able to work closely together to ensure the good health of students.
Uqala bebethi mangabe behamba beya ku school health services nje kube sengathi baya intrude mayifika ama school health nurses ezikoleni ubonthi they don't have that understanding why are they interfering nokufundisa kwabo. Kodwa after introduction of integrated school health program wangena u Department of Education.
Sister Mbingo is one of the highly experienced nurses who are part of this program. She began working as a nurse in 1998 and is using her years of experience to help school children in the deep rural areas of Newcastle.
Ingizimo esiyitholayo ngelanga ngizokhipha anikhipha iphele elikhulu kanjani endlebeni engane kunzima impela enganeni especially zasemakhaya. At the end of the day uyokuyicabanga lezi zinto uthi ngibona ingane enjena ene problem enjena.
The school's health program bridges the gap between rich and poor by ensuring that all school-going children across South Africa have access to healthcare.
Before NHI, we had very little coordination in terms of school health services, but because school health services are now a policy of the department, we have a more integrated and more focused approach, and we feel that we can enhance and produce good outcomes for our children.
As this program is still new, there are a lot of challenges that the nurses are currently facing.
Sibe ne transport dedicated to us and kube imoto ezisafe because si travel endaweni engafani ezinye ze gravel ezinye zithadi ezinye ze imoto esisebenzisayo azikho roadworthy.
I'm not just driving for fun. I'm driving ukuthi ngikwazi ukuhambisa usizo kulabantwana abadinga usizo. Reach out to the kids ezikoleni.
Ukuze sikwazi ukuthi sifunction according to the expected standards, we need to have equipment. So we're running short of equipment. Some instances kuze kugcine kudinga ukuthi sithenge enye like ama stethoscope.
Ukuthi ke inkinga sibancane khona izikole ezi-enrollment, big enrollment, ama grade R's thokuthi bagijima ko 60 iclass elodwa.
These teams of dedicated nurses are hopeful that the school's health program will be a success. But in order for that to happen, they also need the cooperation of parents.
The consent forms are extremely important because we cannot provide a service to a child without the consent of the parent. I would say there are lots of concerns for litigation. Obviously, a parent does not consent to a child receiving care. You cannot provide care to that child. There have been cases where doctors have actually challenged this consent, where the child is, for example, seriously sick and the parents refuse to actually treat the child, and the doctor in that case actually overrides or overrules the consent of the parent.
Before ingane size sithinte fanele ukuthi umzali uvumile uyabhala in writing ngoba ama consent ethu sisebenzisa lana abhalwe ngesizulu senzele ukuthi umzali ezo understand. Abakhona kama cases lapho khona umzali ebhalile nje ngepeni ukuthi angivumi ukuthi eyami ingane ihlolo. enye kuyenzeka ukuthola ukuthi siyayibona yona ingane ukuthi ine-problem kodwa umzali akavumi sigcine sitheke akasiceleleke yena umzali ukuthi akafike khona sizomchazela ukuthi kubaluleke ngani ukuthi ingane ayihlolwe.
Also, as part of the school's health program, the Department of Health will be providing mobile clinics to make it simpler for nurses to provide healthcare to children on the spot.
It will be much easier because the van will be equipped with all the facilities and all the resources so that it will, it will not result in delays in transferring that child to a facility. The child would be seen in the mobile van. A comprehensive service is delivered because the child has a problem with the teeth, they can be seen in the mobile van. If the child needs to get glasses, they are seen in the mobile van. If the child needs to have a minor procedure done, everything is a one-stop shop in this big van. I would say to the nurses, we have huge respect for them. They are a fundamental part of the plans of the Department of Health, that we support them, and furthermore, we depend greatly on them. So we have a big responsibility to ensure that whatever activities we undertake, it should be such that it will be implemented throughout South Africa. So the future is bright for us, we're embracing it, and we hope to continue and improve on the systems that are in the health system currently.